Good afternoon, everyone. Thank you for joining our webinar. My name is Lorraine Getch, and I'm the VP of Sales for Mtbc, and I have a special guest with me today. Her name is Dawn Roman. She's the Senior Director of Network Relations, and I'm going to hand it over to her now.
Hi, thank you, Lorraine. I appreciate that warm introduction. As Lorraine said, my name is Dawn Romand. I'm the Senior Director of Network Relations for Partners in Care. We are New Jersey's oldest and most innovative IPA. And before I begin, I'd like to just start with a couple of housekeeping items as we begin this webinar. All attendees are joined into the webinar in listen-only mode. To ask a question or make a comment during the webinar, please type in your question in the question section of the GoToWebinar panel. If for the sake of time we are not able to answer your questions, you can reach us via email. Okay, now let's begin with the Partners in Care story. Back in 1995, St. Peter's University Hospital in New Brunswick, New Jersey began a physician hospital organization with the local physicians from the community. About 10 years into that time, the physicians decided they wanted to do it on their own. So they spun off completely from St. Peter's and formed an independent physician-owned IPA, which stands for Independent Physician Association. Because of the 18 years that Partners in Care has been in this business, we are the oldest and most innovative IPA in the state of New Jersey. Currently, my network oversees 375 primary and multi-specialty physicians, nurse practitioners, and physician assistants. In last year, we have grown from being represented in 8 counties to 12 counties, and I've added approximately 135 providers to our network, so you can see how we continue to grow daily. There is absolutely no annual dues for primary care physicians, specialists, nurse practitioners, or physician assistants. We do not mandate where you have privileges at a hospital. We do not mandate that you have courtesy privileges anywhere, so it's truly an independent IPA with no annual dues for any of the providers in your office. The second branch of Partners in Care that I'd like to talk about briefly today are our clinical and ACO services. We are a true population health management company. We work with insurance payers and self-insured organizations and employer groups that hire us to manage the population that either works for them and they're covered by their benefits, or who are part of the various insurance companies that we have contracts with. We do full care coordination. We are able to assist with patient-centered medical homes, which, as you know, with healthcare reform is a very big portion of what's going on in the market today. We assist and handle very easily disease management issues that arise. We work with providers and hospitals as well as insurance payers on the readmission programs in the state. And we have most recently begun a Medicare ACO for the providers in our network. Some of the additional benefits are enhanced contract revenues. As I said before, Partners in Care has just kicked off a Medicare ACO, so there'll be shared savings that will come as a result of that program as well. We're offering educational programs to our providers, that would be physicians, mid-level providers as well as nurse practitioners and physician assistants, up to and including staff of the offices. We are a true partner with the providers that are part of our network. In addition, your office is also paid for any revenue when we discover that there is a gap in the patient's treatment. We receive data from the various insurance companies. We populate that through our proprietary software, and then we find the gaps that may have been applicable to the said patients. We reach out to the provider offices. We alert you to the gap that we found. You confirm that it is indeed the case. When you reach out to the member, you're able to, A, generate revenue because we pay you for that time. Secondly, when you bring the patient back in, filling up your schedule and you're receiving funds for handling the patient, so you get to bill the insurance company and you also get to collect a copay. And at the end of the day, you have a happier patient. Those are some of the things that make Partners in Care a very unique IPA, as there are no fees to join. We absolutely work behind the scenes, so we are the hidden secret behind the provider offices, partnering with you at every step of the way. We have continued to grow our network daily. We're in 12 counties, and we would love to have you join us. My contact information is listed at the bottom. My phone number is 732-246-0291. or my cell phone, 732-425-5100. My email address is dromond, that's D-R-O-M-O-N-D, @PICCORP.com. And our website, which you're welcome to visit, is www.piccorp.com. Thank you for your time, and we'll begin with a couple of questions. Okay, the first question, how much does it cost to join Partners in Care annually? Thank you for the question. There is absolutely no fee whatsoever. Never has been in the 18 years that we have been in existence, and we're very proud of that fact. I have a second question. Is PIC owned in any way by a hospital? No, the answer is no. We have not been owned by a hospital since 2005, so we're working on 8 years now where we have been a completely independent physician association. Third question. Is the network closed to any subspecialties? No, absolutely not. Our network is completely open. We're not closed in any way, shape, or form, and we're very happy to have you join our network. Another question has come in. What if we hire another provider in our office? That is not a problem. If you initially contract with 1 or 2 providers or however many you have in your office and you add someone, all you need to do is call me and we can either add them as an individual provider contract, or after you hit 2 or 3 providers in your office, I can flip you over to a single signature contract that can be signed either by your managing partner or your practice administrator, depending on how your infrastructure works at your organization. Are there any other questions? Okay, well, I want to thank you for your time today. Again, my phone number, if you have any other questions, is 732-246-0291. And my cell phone again is 732-425-5100. Please don't hesitate to ask any questions that you have. I look forward to hearing from you. Thank you.